All right. The more you know, the kind of crazier you can get with this. But we're going to make this, we're going to do this just kind of as the first step. How to use the information that we just talked about. Let's say, remember, you always want to be kind of thinking about this kind of stuff when you're talking about where a lesion is or how you're going to be affecting them with an adjustment. Let's say that this patient has a left, just like right up here, a left mesencephalon lesion that's not too crazy, all right? I mean, it's not like super metabolically fragile. How can you use the eyes to further stimulate that midbrain with an adjustment? Something probably everybody would like to kind of know. So, first of all right, what did I just say? The right mid or left midbrain. So here's what you have to know. That's why that rule, all superior knee muscles are contralaterally innervated. That's why this is important. So I want to stimulate this guy. Let's say I tell the patient to look to the right and up. Okay? What eye muscle is going to be on this right eye? What's the primary mover? Superior rectus. What about over here? What is it? We already forget? Inferior. Dang. Alright. So, remember, we want to stimulate this over here. Superior rectus. Now remember, this is all, if you aren't familiar with this little drawing, this little box is the mesencephalon, this is your pons, this is the medulla. Okay?
Well, could you put right and left up there?
Yep, sorry. Alright, so we want to stimulate this guy right here. Well, that area. This superior rectus, so what nuclei is innervated or innervates the superior rectus? 3. So this is the right superior rectus. What side 3 is innervating?
Left.
So far so good, right? What innervates inferior oblique? 3. Is it ipsilateral or contralateral? Beautiful, right? So if you want to stimulate that left side mesencephalon, you're going to look up and to the right. Now, however you want, I really hate memorization, because if you memorize something, there's a chance at some point you're going to forget it. But I understand in the beginning sometimes that's how you got to do things. But if you just kind of learn physiology and kind of picture this in your head, there's nothing to forget, because you can just do it in your head. But that's kind of how it works. But now let's say you want to stimulate the right pons. Where do you think I would look? So if let's say I wanted to look this side. Huh? So, what eye muscle is? Lateral rectus, which is 6. And this would be medial rectus, which is still, I'm sorry, it's still mesencephalon, but now you're creating pons. You kind of see the thought process? Good? Ask me any questions about this, because everybody always wants to know how to use eye muscles in an adjustment to further stimulate something. No questions. Everybody kind of sees how to do that. So that's kind of how you use the information we gave you as far as, and as you learn more, you can kind of get a lot crazier with it. Certain kind of eye movements to stimulate different kind of areas of the brain, like the cerebellum, different areas of the cortex. All right, so we have that. Next thing we're going to talk about, I'm going to give you a couple of tests to do concerning the eye muscles, and then we're going to break out and.
I just want to make sure I understand what you just said. So if we want to simulate 6 on the right while we're adjusting the lunar, simulate the umbilical, we're going to have a meter on laterally to the right.
You basically just want to think of where can I look that is going to give the most stimulation to that area. It's basically what you're kind of trying to do over here. Any other questions? Good. All right.
So in that situation, it wouldn't matter whether you were spotting or pursuing, because you're already simulating the mid-range.
It does matter, but for the purposes of what we're doing in here, it's just having them looking in that direction while you're giving the adjustment. But if you do, let's say if you do a pursuit, I haven't really talked about it yet, but those of you that know, if I do a pursuit to the left right before I do an adjustment, what part of the cortex is that thing?
Right.
If I have them saccade to the left right before I do an adjustment, what part of the cortex? So there's always, everything in neurology pretty much always matters. But it's just a matter of to what level is your knowledge to how you can utilize it, basically. Is there any other questions? Right now in here, and we just talked about last week or a couple weeks ago, how to further utilize this in Advanced Club, which is, that's why you kind of want to get into Advanced Club, because you learn this material, you get to learn more stuff. But again, for this kind of level, just think about what direction you want to look for an adjustment. Okay, we're going to talk about saccades. So saccade is a fast eye movement. Okay, it's going to be generated from the contralateral frontal cortex. If I saccade to the left, right frontal cortex. Okay, a pursuit is a slow eye movement. Okay, slow eye movement that you can only do when you're tracking something. So when you're reading, you're not actually pursuing across the line, you're actually doing a bunch of little mini saccades. If you ever try to just sit there and do a pursuit without anything moving, you're not going to be able to do it. So it's a tracking mechanism. But that's the slow eye movement, and it's going to be to the ipsilateral parietal lobe. So left saccade, right frontal cortex, left pursuit, left parietal lobe. Everybody good with that? Okay, let's talk about how you're going to test for it. What you're going to want to do is, whenever you're doing stuff, testing with the eyes of the patient, you always want to make sure that you're not putting them into convergence, all right? Which means what? When you get too close to focus on whatever they're looking at, their eyes are going to have to do this. The reason is that is going to stimulate different areas, and you're actually testing other things than what you want to. So you want to make sure, until you get used to it, you can even kind of do this. Tell them first to follow my thumb, and you're going to bring it in, because if they have, there's some issues that somebody might have where if you do this, it's going to be really bad for them. You just jack your thumb in there. So just kind of bring it in. When you see their eyes converge, bring it back out until you see their eyes stop diverging, and maybe bring it out a little bit more. I'm short, so you want to be, it's kind of sad, sitting now on the same level. All right, so you want to be on the same level as the patient, all right? Now, and I'm getting better at it, I've been known to do this sometimes. You want to have a doctor error by doing something like this. So make sure that you are level. One way to do that, you can kind of bring your hands in here and just come out to your shoulder width, okay? So what you're going to do is you're going to tell them to look at your nose, and when you see one of my thumbs move, I want you to look at that thumb. And you want to tell them to hold it there until I tell you to come back to my nose. The reason is, something we talk about in Advanced Club, we want to look at their ability to gaze. All right, gaze is the third type of eye movement. It's basically just being able to stare at something. I guess I should have said that. So gaze is fixating on something, and basically a pursuit is a moving gaze. The ability to fixate on something while it's moving. Anyway, all right. So we're going to look at the thumb. Back at the nose. Back at the nose. All right. You're going to see, when you do this, a lot of different things. Right now, all we're going to talk about is when you move your thumb, they should be able to quickly respond to seeing that in the periphery and saccading over to it. If it takes them a second to kind of look over at it, you're going to say that's a frontal lesion. That's a frontal sign. Okay? Pursuit, you're going to tell them to look at your thumb, and it's kind of a good idea to kind of stabilize yourself, because again, when you get more of these complex patients and you start learning more about what different eye movements mean, you want to be as straight with yourself as you can. Also, another good idea, instead of just moving your arm side to side, it's kind of good to kind of lock yourself in and just kind of use your body to do it. You're going to say, follow my thumb. Okay? What we're going to say here is just that if there is an issue with the pursuits, you're thinking parietal. So if it's choppy, if it's whatever you're seeing, right now we're just going to say you're thinking parietal. All right? So if there's too long of a latency with the saccade, it's going to be frontal lobe. If there's an issue with the pursuit, it's going to be parietal. Any questions with this? All right.